Good afternoon and welcome to Miller Thompson's Health Industry Coffee Talk Director Series. I'm Karima Kanani, a partner in our health industry group, and I'm delighted to be joining you this afternoon for a governance guide for health service resumption, What Directors Need to Know. A couple of housekeeping items before we dive into our material this afternoon. There are a significant number of participants that have joined us today, and we do thank you all for your interest in the session today. All of your lines have been muted, and we ask that you remain with your line on mute throughout the session to enable all of your colleagues to hear all of the material clearly. You will also notice that the chat box feature is not enabled for this session. Due to the number of participants and the amount of material that we want to cover together today in our short hour, we will not be able to hold an open Q&A session with the group today, but we do always invite your questions, and our full contact information is available on the slides. You're welcome to reach out to me with your questions at any time. So with that housekeeping aside, we do have a lot of material that we're going to go through together today, and what's the journey that we're going to walk over the next hour. Our agenda for this afternoon is first a quick recap on where we stand with the COVID-19 restrictions in the province. What is the current status? Secondly, we're going to take a look more particularly at health service resumption planning and what are the key or core components of a health service resumption plan. Now, of course, today we're joined together for our Board of Directors series. And so in speaking to all of you, the focus that we want to take is what is the role of the board? As directors on boards of health service providers, what is your role in the health service resumption exercise? And to that end, we're going to look at your risk oversight obligations. Last, but certainly not least, we will round up our discussion looking forward as to what are the things that are on the horizon and that the board should be mindful of as it works towards the future. So where are we now? It seems like almost a lifetime ago that the pandemic was declared in our province and in the world globally. And in fact, that was on March 11th, 2020, that COVID-19 was declared a global pandemic by the World Health Organization. Shortly after that time, the government began to invoke its powers. And its powers to act during a time of a pandemic come from two sources. One is public health legislation, and the other is emergency management legislation. And so you see the names of the acts there on the slides for you. In Ontario, the state of emergency was declared on March 17th, 2020. That has continued to be extended over time. And most recently, as of yesterday, we know that the extension is going to be till June 30th of 2020 so far. The stating a declaration of the state of emergency, what does that do? What does that do for the province? Well, it enables the province to make various orders and directives that then enable the advancement of the health and safety of the population during this time of the pandemic. In fact, under this emergency legislation and through the declaration of emergency, 44 emergency orders have been made to date. Now, what's important to note is that today we're talking more specifically about service resumption. And so what I want you to keep in mind is, notwithstanding that we continue to be in a declared state of emergency in the province, that does not mean that service resumption can't also commence during that time. And in fact, it will be commencing during that time. At the same time, there were various orders and directives that are passed specifically related to the reduction to essential health services. So you may recall the order that was made for the closure of non-essential businesses. And this was one that was by virtue of exception. So there's an essential business list that was included as Schedule 2 to the order. And if you were on the list, then you were permitted to continue in operations within the scope of what was identified for your business. And if you weren't on the list, then you were deemed a non-essential business. There were, of course, many health services that were listed as essential businesses in Schedule 2, but also within that, a reduction to urgent services only. At the same time, a directive was passed under the health protection legislation. So we talked a minute about how there's these two areas, emergency legislation, health protection legislation. Orders and directives have been coming out under both regimes. The directive number 2 for healthcare providers was issued by the Chief Medical Officer of Health, directing regulated health professionals and persons who operate group practices of regulated health professionals to cease or reduce to minimal levels all non-essential and elective services until further notice. Now, participating in our session today, we have a very wide variety of health service providers across the continuum of care, from public hospitals to individual regulated health professionals running their individual practices. And so across that spectrum of you, there was no definition that was given here of what was deemed to be an essential or non-essential service per se. And many of you have had to grapple with what that meant for your organization and your ability to render in-person services to your patients and your clients. That continued for some time. And on April 26th, the government released a framework for reopening our province. It was a welcomed positive indication that we would perhaps be beginning to work towards bringing services back to our communities. Following on that, May 14th, Stage 1 plan was announced. Part of that plan included the lifting of restrictions on in-person services delivered by health professionals. And there are several measures that have followed on that in order to enable this Stage 1 of the plan. And I'm going to take a minute to park on each of them. But there was an update to the list of essential businesses. There was a release of a measured approach to planning for surgeries and procedures, directed more particularly at our public hospital colleagues. There was an update made to the directive number 2 that we just talked about under the health protection legislation for healthcare providers. And there was a release of the operational requirements for health sector restart. And it is these items that then set the basis for the discussion that we're having today about health service resumption planning. In respect of the essential businesses, and I've listed for you here on the slide, all of those that fall under the health umbrella, under the essential business list from items 36 to 44, highlighted there is where you'll see on item number 38 that previously, under the restrictions in the list, it had indicated regulated health professionals for urgent care only. And that's what has now been removed from the list of essential businesses. This was not a static list. So if you take this and you're looking back to those that have been issued previously, you should keep in mind that it has evolved over time since the first time that that order was released. And at this current time, this is what it reads at this moment as what are deemed essential businesses that can function in the province. Alongside the changes to the definitions of business, we talked about this release of a measured approach to planning for surgeries and procedures during the COVID-19 pandemic. Now, this has been directed more to our public hospital colleagues, and it was released in early May. Part of the reason for its early release, notwithstanding that we were not commencing the resumption of services at that moment in time, was because it requires a considered amount of work in planning that needs to be done to bring the organization to a place where surgeries and procedures can in fact commence. And so it was introduced early in order to be able to set criteria out to guide that preparatory work. It includes several core expectations for hospitals that must be met in order to be able to resume services. And as we know, there are thousands that have had their procedures delayed and that continue to remain on wait lists for procedures within hospitals. In order to be able to begin servicing those individuals again and prioritizing how we will address that collateral effect of COVID in the wait lists that have been created, the hospitals must first be able to reserve 15% of their acute care capacity for a potential COVID-19 upsurge in the future, or look at alternate regional capacity. So beginning, but still at the same time preparing for the eventuality that we might need to again shut down to respond to COVID-19. Interestingly, one of the other expectations is no hallway healthcare. So much of the dialogue in our sector has fallen silent on health system transformation, which was something that was very well active immediately prior to us entering into this pandemic stage. And as we all know, one of the key tenets of our health system transformation work across the province has been targeting the challenge of hallway healthcare that has plagued our healthcare system across Ontario. So it's very interesting that one of the expectations of hospitals is ensuring that there is in fact inpatient space available and that there will be no hallway healthcare. Requirements for stock of PPE and other supplies. There's been much in the media and within our sector around access to adequate PPE and PPE stock supply, as well as the availability of HR, which is an issue for some of you than for others. And we're going to talk a little bit more about HR and bringing employees back. Ultimately, these plans to recommence surgeries and procedures within public hospitals have to be signed off not only by the hospital, but also the regional table. Now, beyond meeting those foundational requirements, what it also requires, and to highlight, is a feasibility assessment as a very first step. And it sets out 9 factors and gives some specifics on each of these factors, which I won't be able to go into all of these with you today. But based on these 9 factors, an initial feasibility assessment is to be conducted. And what's important to note is that this is a continuing obligation for the public hospitals. In fact, these feasibility assessments must be updated on these 9 criteria on a weekly basis. If you can meet those feasibility criteria, then you proceed with planning and implementation of planning, which is again based on a detailed list of considerations in this measured approach that include regional status, COVID-19 cases, health human resources, supply chain, and again, as we mentioned earlier, ramp down planning. And so as I've highlighted previously, the foundational requirements and these various criteria and considerations, in order to meet these, given the state of the healthcare system as it is, will no doubt require some continued discussion and dialogue from a systems perspective. And the measured approach document does acknowledge that and suggests that organizations do consider co-design with their Ontario Health team members or other community partners when engaging in planning to be able to meet these criteria on a sustained basis. A few weeks later, after this measured approach was released, the public hospitals began active work on some of the feasibility assessment and planning. Was very importantly the change made to Directive Number 2 under the Health Protection legislation for healthcare providers. Why was this so critical? This was critical because it is the change in Directive Number 2 that in fact enables the restart of the previously deferred health services. So prior to May 26th, although there was intention communicated and planning commenced, there wasn't actually the legal ability to commence the resumption of those services. That is now in place with this new Directive Number 2 that was issued last week. It wasn't issued as a blanket, it is issued with certain very specific conditions and requirements that must be met. The first is compliance with the COVID-19 operational requirements for health sector restart. I'm going to talk about that document in a minute, but it was released at the same time as these changes to the directive were made and contains a number of very detailed requirements that must be met. And these requirements and this directive apply to all healthcare providers, not just to public hospitals in the way that the measured approach document was targeted. It includes a requirement to consider which services can safely resume in person with appropriate hazard controls and PPE. It sets out principles for proportionality, minimizing harm, equity, and reciprocity in setting out plans for health services restart. It also requires alignment with any guidance that is released by applicable regulatory colleges, and we will talk about that in a minute, as well as, importantly, compliance with the Occupational Health and Safety Act. Now, this is quite fundamental for some of you who perhaps have not engaged in detail with that act before, depending on the size of your organization. As I mentioned earlier, we have a very broad continuum of health providers participating with us today. Some of you will be quite familiar with obligations under the Occupational Health and Safety Act, and others of you less so. And this is an important factor in resumption planning, and we're going to talk a little bit more about that today as well. So sitting like two peas in the pod with the directive number 2 is this operational requirements for health sector restart. It is interesting that they name it for health sector restart, because as for many of us, we know although you ramped down in your in-person services, you haven't closed services for many of you completely. And in fact, services have continued to be delivered through virtual and other alternative means. So it's interesting that they call it a health sector restart in that way. It's more of an in-person service restart. What it does is it sets out measures that have to be in place to meet public health guidelines and to promote a safe requirement. Everything that's in here is a requirement to resume in-person services. Now, interestingly, it does emphasize that when and where possible, you want to continue with virtual and telephone consultations and advice. It requires, as an initial requirement, foundational to these requirements, is an organizational risk assessment and a point of care risk assessment. Organizational risk assessment looking at controls at the corporate level and organizational level. Point of care risk assessment being done by the individual professionals directly with the engagement of individual patients and clients. And it talks about a hierarchy of different controls that are to be considered when commencing your planning for restart. The requirements that are set out in these operational requirements for health sector restart are quite comprehensive. And I'm not going to go through all of them with you today, but I have highlighted all of the categories that are here on the screen, because they do go into some considered detail on all of these items, including physical environment, infection prevention and control, and again, importantly, you see again, occupational health and safety. Now, there are several other guidelines that have also been released by the Public Services Association. We've included many of those on the slide here. This is not an exhaustive list, but depending on the nature of health services that you provide, you want to check here to see if there are additional guidelines that have been released that are specific to the nature of services that you provide. For example, they have one that's specific to personal support workers and home and care providers. They have one that's specific to dental offices, etc. These guidelines generally, again, cover the same topics: physical distancing, hygiene, reporting, use of PPE. All of the themes and items that are addressed really across the board in all of these documents that I'm talking about. However, you need to be mindful of the fact that although they address all of the same types of things, they may articulate different requirements and some guidelines may be more or less prescriptive than others. So it's important as a board that you're aware of which of these guidelines in fact apply to your organization. If you don't see yourself listed there, the message is that these guidelines that are being released are continuing over time. There may still be more forthcoming. There may be updates to all of these documents. And the ministry, in fact, highlights the fact that you should keep an eye on these updates that will be coming. And nevertheless, the principles that are contained in all of them really apply across the board from a risk management perspective in engaging in resumption planning. Now, I did mention to you earlier that the regulated health professional colleges are also releasing guidelines, and so you want to be mindful of which regulated health professionals are engaged in your organization delivering service, and again, which of those guidelines will then apply to you as well. Now, as a board, it's difficult, right? Like, you're not tasked with knowing every detail of all of these guidelines. Your leadership teams will be responsible for that. But it is your role as a director to hold them accountable to do so. And what I would say to you as a board is that for health service resumption, there are some minimum must-reads. And those minimum must-reads are, in fact, this update to Directive Number 2 and the operational requirements for health sector restart. If you're a public hospital, the measured approach to planning for surgeries and procedures should be added to your essential reading list. And as a director, there's a lot of material out there, a lot of orders that have been issued, articles and guidelines that have been released and published. It's difficult to, wrap your head around all of it, but these are what I highly recommend to you are the essential reads for every member of your board as you proceed with health service resumption, to really have an understanding of what are the requirements that are placed on your organization and how are they going to be met. And that takes us to health service resumption planning. So how do we take all this information, these guidelines from a variety of different sources that apply to your organization? All of that material forms the foundation of what I call legal requirement foundation or floor to the health service resumption planning process. That information, those requirements and parameters will reflect themselves in a variety of components of your resumption plan. And there are 4 key pillars to every service resumption plan, regardless of the environment within which you are delivering services and where you are across the continuum of care. Those 4 key pillars are clinical service, facility and space, business process and supply chain, and human resources. And in order to be able to address those 4 pillars, you must first, as a foundational element, have a solid understanding of the legal requirements that have to be reflected in your resumption planning in each of those areas. So what are those legal obligations? As I went through the basic facts of where do we stand now in our province on the COVID restrictions and health service resumption, we covered some of those sources of the legal obligations. And you'll need to identify and address obligations under federal requirements, provincial requirements, municipal requirements, as well as public health orders and directives. So the key message that I want you to take away is it's not just the information that I was conveying to you earlier. There is a broader pool of requirements and guidelines that would need to be followed, and that you need to consider also at the local level, because municipalities also within your own regions may have certain prescriptive requirements that must be met. In addition to that is, of course, also the regulatory college guidelines that I spoke about earlier, all of these materials being updated frequently and requiring continued monitoring for compliance of the organization. In addition to all of those, what we generally call health regulatory laws, directives, guidelines, legislation, are also 2 other bodies of law that have reflected themselves in all of these guidelines as foundational to resumption planning. One is labor employment law. There are new emergency leaves that have been introduced, and some of you have employees that are currently off from work on the basis of these new emergency leaves. Others of you have needed to engage in layoffs as you close the physical doors of your spaces, and so resumption of services requires you to also consider carefully the legal requirements that apply to managing a recall of those individuals from layoff. There are also rights to accommodation, whether that be on the basis of needing to care for somebody who's sick, childcare obligations, a variety of reasons, as well as rights to work refusal, which arise from the Occupational Health and Safety Act that we'll talk about in a minute. And there are a lot of changes to the way that you're going to engage in in-person business. You're not just going to be able to return to health service delivery in your physical spaces in the manner in which you were engaging with it previously. And there are legal implications to the manner and method by which you change the parameters of work and what is expected of your employees and agents. Another legal foundation to your planning is, as I've mentioned several times today, the Occupational Health and Safety Act, and I cannot underscore this one enough. It is a very detailed statutory regime that must be followed, and what it contains also is rights for workers, and here workers include employees, but also independent contractors, independent contractors, a right for these workers to refuse unsafe work. Now, many of you in your environments will not have had to deal with this type of thing before because there may not have been assertions that your workplaces were unsafe. And so you need to be very mindful of the fact that in a COVID environment where we are resuming the delivery of in-person care, the potential for refusal to work or work refusal under the Occupational Health and Safety Act on the basis that the work is unsafe is quite possible. And in the event that someone exercises those rights, there's quite a very detailed statutory procedure and criteria that must be followed and considered. In addition to that are requirements under the Act to have supervisors who are competent and knowledgeable about what those requirements under the Act are, as well as reporting obligations that arise under this legislation. So if we take that legal foundation and we look then at the 4 pillars of resumption planning, I want to take a minute just to highlight some of the types of questions that you want to be mindful of and what you would be looking for when you're presented as a board with the health service resumption plan. Now, the board itself isn't going to be engaging in the development of this plan, but you need to have an appreciation as a director of what the core components of this plan should address in order to be able to engage in a critical way and a constructive way with the material that's coming forward to your board table. In respect of clinical services, there are various questions and actions that will need to be addressed. The clinical services that you deliver as an organization need to be adapted due to the physical distancing and other health and safety requirements arising from all of these laws, orders, directives, and guidelines that we have talked about. How are you going to determine which services will be offered in person and to whom? Now, resumption of service, as we've indicated, doesn't mean it is back to delivering services as they were pre-COVID. You'll need to start perhaps with some services initially or with a reduced number of clients. And how are you going to make those ethical determinations as to what you will commence with and whom in an environment where everyone is in need of the services that have been deferred or delayed? New policies and procedures for patients and clients related to COVID screening and potentially also related to the use of PPE in the environment, as well as protocols for PPE, not only for the patients and clients, but also for your own employees when they're engaging with patients and clients. Of the health service resumption plan is facility and space. And here, the types of questions that I want you to be thinking about is in looking at the physical space that you're located in, and what are the rules that apply to that space, and how can or cannot it be reconfigured to be able to meet all the various requirements that you need to meet to commence health service resumption. So questions to ask yourself is the premises leased or owned? Where you lease premises, there may be terms and conditions to which you're subject in your lease and certain rights that may be accorded to your landlord in respect of your ability to make changes to your physical space and configuration. Are you located in a multi-tenant premises? Some of you operate clinics and other services from locations where there are others that are located adjacent to you in a multi-tenant building or complex. In those circumstances, you'll need to consider whether there are obligations that apply to all of you in that physical community and how you're going to coordinate health and safety measures among all of you in the interests of your patients and clients. Implicated in that will be ingress and egress from the premises, including where are you going to do screening and how are you going to engage in waiting areas, whether that will be inside or outside of your space, and what ability do you have to do that and to take those measures in your resumption plan. As well as looking within your own space at how you're going to use space differently, especially when it comes to communal spaces like meeting rooms, kitchens, washrooms, etc. The third tenet of your health service resumption plan will be around your business processes and supply chain that in fact support the delivery of your clinical services and the operation of your health services within your physical space. You're going to need to consider how all of the requirements that we've talked about are going to impact your business workflows and administrative processes and what adjustments will need to be made. What is your current inventory? How are you going to forecast what will be your service and supply needs, for example, importantly related to personal protective equipment? And to that end, supply chain management and contingency planning. What happens if there is a delay or unavailability for any of the services or supplies that you require for your space? Where they relate to matters like, for example, cleaning services or access to PPE, there are fundamental decisions that will need to be taken about the ability to continue and the risk of continuing with the delivery of in-person services, both to clients and to the organization. And you want to engage in that thinking early and have contingency plans in place and not wait for those incidents to arise. And the last key tenet of your health service resumption plan is human resources. As we mentioned, you're not going to be able to recommence likely all services that you were rendering prior to the COVID lockdown. And in that, you'll need to determine then, based on what you are going to do, based on the restrictions that you're placing within your physical space in order to resume those services, what in fact are your human resource needs in order to resume services, because it may not be bringing back the entire workforce that is currently moved to remote work or been laid off. Important in considering that is it's not just about what you need, but it's also about what they can provide. And in this context and circumstances that we're in, the availability of human resources has also become a very key factor. The fact that health service resumption is now permitted and can commence, but there are still not measures in place across the province for widespread childcare or activities for children, that's one example of what could affect the availability of your human resources to actually be able to attend and deliver services for the organization. So you need to look at your needs and the availability that exists within your human resource pool. As I mentioned earlier, of course, there is the legal foundation or floor to this planning, and that is extremely critical when we're talking about human resources, because whatever you determine as to who you're bringing back and when you're bringing them back, you have to follow the strict legal requirements of how you engage in a recall of somebody that's on a temporary layoff, how you respond to an accommodation request if it's requested of you. What rights do you have to make changes in the conditions of work, and how will you respond in the face of a work refusal? Not following the legal foundation on these items can open the organization up to further risk and liability as you are working through COVID service resumption. And so at the same time that you're dealing with these processes and procedures to bring people back into the workplace, you also need to revisit past employment procedures and policies that you would have had to make them relevant to the current environment. Here I'm talking about your sick leave policies, leaves of absence, travel policies, personal travel that may not have been a consideration for your organization before will now very much need to be a consideration in determining and knowing where your staff are traveling to and having policies in place about their ability to return to the workplace. As I mentioned earlier, of course, policies and procedures on screening and PPE are essential and expected across the board from all organizations. And none of this will be effective or useful unless there is adequate education and training across the organization of what you're rolling out to be able to ensure that people are aware and also that they continue to comply. So we've talked about what are the restrictions that have been lifted and the guidelines, directives, orders that have been introduced to set requirements for health service resumption in the province. We've looked at that as the foundational floor to then putting together a health service resumption plan that covers the key tenets of clinical service, your facility and space, business processes, and of course, human resources. But it's not you, the director, that's going to be writing that plan or following the letter of each of those requirements that are set out in those documents. So I want to spend the remainder of the time that we have together today looking particularly at what is the role of the board in the health service resumption planning process. How do you fulfill your duties as a director? Well, my first message to you is that board fiduciary duties continue amid COVID-19. We were in a different place a few months ago. The last time we came together in the director series, I was talking to all of you about how to manage your boards and your duties in a time of emergency and crisis. Well, we've moved through that emergency and crisis stage. In fact, now it seems to be a continued crisis that's become the normal. But as we begin to look at resumption and recovery, it's important for the board, if it had taken a step back, to resume its responsibilities. Because your responsibilities, in fact, never changed. It was perhaps how you were fulfilling them that were adjusted. Those responsibilities include oversight of risk and accountability mechanisms for health service resumption and continued compliance management of requirements that are being put into place. This is a critical, important responsibility amplified at this crossroads of resuming in-person services, and boards need to be actively engaged. But what do I mean by actively engaged? I'm not suggesting that you be involved in operational matters. I'm not suggesting that you be involved in frontline development of those resumption plans. And I want you to hear this importantly, that you must maintain the line between governance and management. It is during these times and through our own goodwill and commitment and loyalty to organizations that directors want to be able to contribute and to assist the organization during these challenging times, but you must do so within the scope of your role as a director. In fact, directors who exceed their governance role assume some risk of personal liability because your directors and officers' insurance cover your duties and responsibilities as a governor. They do not cover what would be considered management level activity. Some of you and some of your boards may have scaled back on the meetings that you were having during the emergency phase. In part, that's to support management to be able to take quick and nimble action, and also because we were all in the reaction phase of being thrown into a global pandemic, which was new for everyone involved. However, at this time, it's important that if you did scale back, that you resume, and if you didn't scale back, that you continue with your regular board meeting schedule to continue to be able to govern the organization and fulfill your duties. Continued good governance and oversight is going to be essential not only to fulfill your duties, but also importantly to ensure that the workplace resumption planning and engagement of the organization is implemented in an appropriate and risk-managed way. There's some flexibility that has been provided. So out of all of those 44 emergency orders that have been passed, there are some directly for you as a board. And one of those orders provides maximum flexibility for board meetings to be convened virtually. So, there always existed that ability. Not all of you used to avail yourselves of it, but there's now a very clear ability for boards to be able during this time to meet virtually, and not only for boards, but also for members. We are heavy into the AGM season that is coming up. And so for those of you that need to conduct annual general meetings with your members, there are some extensions that you can avail yourselves of potentially for some of you. And those meetings for members can also be conducted virtually. So there is some flexibility and really no reason not to be resuming appropriate meetings of your board if you have not been continuing them during this time. And that goes not only for the board, but all of your board committees as well. And when you engage in these meetings and you're coming to the table during this time of health service resumption, your duties as a director have also not changed. The core duties of every board and every director are really a threefold. You have what are commonly known and referred to as your fiduciary duties of oversight and policy. And I've really been emphasizing this one today, is your fiduciary duty of oversight that really needs to be exercised. But as we talk today about looking forward, I'm also going to park on your strategic duty, your duty to look prospectively and reactively at the strategic planning for the organization, and your generative governance duties, looking at the organization in the longer term and shifting the cognitive paradigm of your longer term sustainability as an organization in these changing times. And to what standard must you meet these duties? Well, the fact that we're in a pandemic has not changed the standard at which you must meet these duties. And that standard of care comes from the Corporations Act, which indicates that you must be acting in good faith with a view to the best interests of the corporation, exercising the care, diligence, and skill that a reasonably prudent person would exercise in comparable circumstances. And so that begs the question for each of you, what would a reasonably prudent director do in the circumstances of a global pandemic when you're looking at health service resumption? Well, one of those core duties of what would be the reasonable standard for all is engaging in active risk oversight for the organization. And that risk oversight needs to occur at several levels: legal compliance, financial, communications, and liability risk. I want to spend a minute talking about each of these items, and I want to leave you with some board action items that you can undertake after this session together with your board in respect of each of these areas of risk oversight. The first is legal compliance. We've talked a lot about legal foundation and underpinnings to your health service resumption planning as an organization today. I've pointed you to a lot of sources of those obligations. And I want to emphasize to you here that your general responsibilities as a board include ensuring that the organization is functioning in a manner that is legally compliant. But it is even more so important in these circumstances because there is avenue for personal liability for each one of you as directors and officers in these circumstances specific to the pandemic and these emergency legislations that have been invoked. For example, there is personal liability if there is non-compliance with an order that is made under the Health Protection and Promotion Act. There is potential for personal liability, fines, and potential imprisonment for directors and officers who fail to comply with emergency orders made under the Emergency Management and Civil Protection Act. And I've mentioned several times today the Occupational Health and Safety Act, which also provides for a level of personal liability on directors and officers for non-compliance. So this is important not only for the organization, it is important for each one of you personally. So what do you need to do? Board action items to ensure risk oversight for legal compliance. Number one, ensure that your board is educated on your evolving legal obligations. Do you know what those obligations are? Are you familiar with the Occupational Health and Safety Act and with all of the guidelines, rules, and regulations? I've given you some essential reading today to take away. Ensure that your board is educating itself on the obligations with which it must comply. Require a legal compliance review of the health service resumption plan. It will be your management and leadership team that will be actively engaged in the planning and ensuring that that plan meets the various requirements and guidelines to which your organization is subject. Your responsibility as a board is due diligence. And to perform that due diligence responsibility, my suggestion to you is to require that you obtain a legal compliance review of the resumption plan that your board can then rely on to be able to say that you obtained this review and that your plan is compliant with all of your obligations. Risk assessment is key from a board perspective. And what you want to engage in is an enterprise risk assessment of your organizational readiness to, in fact, meet those obligations. Knowing the obligations and having a plan that sets out how they're going to be met is not enough. Your organization needs to be ready on the ground to, in fact, in practice and implementation, satisfy those obligations. And you want to be able to assess that as a board. And as I've mentioned, certainly with the introduction today, we've seen the breadth of material that is out there and that will continue to be forthcoming around COVID-19 restrictions and health service resumption rules. It may be beneficial for you as a board to establish a special subcommittee that will be on this risk oversight from a legal perspective on matters related to COVID-19. Second key component to risk oversight for your board is financial. The pandemic is anticipated to have significant economic impacts locally and worldwide. Some of you have felt this acutely already. In responding and managing to COVID-19, there's going to be both short and in the long term additional financial burdens that will be placed on your organization. It's all fine to talk about the need to do these various assessments that you are obliged to complete, to develop the various plans that you are obliged to produce, and to implement the action items arising from those plans across all of the areas of the key tenets of the resumption plan. But that is going to involve time, and it's also going to involve money, and that will have financial implications for the organization. Some of you have access to additional support funding for COVID-19 response, but that has not been made widely available to all of you, and it is not widely available for everything. And so it's important as a board to be mindful of what are the additional financial needs of your organization, what funding is available, and how are you going to meet those needs. Add to that the challenge that in the current economic climate, fundraising sources that you may have previously relied on may no longer be available or may be reduced. So, for risk oversight, from a financial perspective, your board action items are: number one, identify what your financial needs are going to be to support your health service resumption plan. Ensure that you're asking that question when this plan comes before your board table for approval. Assess the adequacy of funding that you have, including your COVID-19 support sources. Reevaluate your fundraising capacity. Don't rely on your previous fundraising assumptions or plans that have been developed by your organization. It is time to reevaluate and refresh based on current circumstances. And think broader than your own organization. Look internally first for a gap and opportunity analysis on areas where you may have certain operational redundancies, and identify other potential partners that you could collaborate with or consolidate with during these times in order to manage the additional financial burdens that will come with resuming services in this environment. The third area of risk oversight that I want to emphasize today is communications. Effective internal and external engagement and communication is necessary. It is necessary for successful implementation of your health service resumption plan. The plan on the paper is only as good as your ability to receive buy-in from all of your stakeholders to that plan and to have them implement it and follow it through. The same goes for adoption and compliance with any new policies and procedures that you may be introducing to the organization during this time, and all of you will have new policies and procedures. Again, they're written on paper, and you need to bring them to life. And to bring them to life, you need to effectively communicate what you are intending with those policies and procedures and ensure people are educated and are able to embrace what those requirements are. Communication is also essential to reduce anxiety of your employees internally around the return to work and what measures will be in place for their own protection, both financially and physically, as well as reducing anxiety of patients and clients, many of whom have had deferred or delayed services and will be seeking that comfort from you as to what will be available, when it will be available, and how they will be protected in coming to receive care. Increasing stakeholder confidence, and importantly, and we're going to talk about this in detail in a minute, is litigation risk management. You really cannot underscore enough the importance of having a proactive communications plan internally and externally to reduce the potential of litigation risk for the organization. So what do you do? Board action items for risk oversight in communications. You want, as a board, to ensure that you are asking whether there has been stakeholder engagement in the health service resumption planning. We remember from our health system transformation days that we've talked extensively about concepts of system co-design with all of our partners in care, as well as with patients and with clients in patient-centered care. Those principles and tenets shouldn't be lost during this time. You want to ensure that you have effective stakeholder engagement in your resumption planning. Ensuring that the organization has developed internal and external communication plans that are going to support workplace transition for employees, that are going to support service resumption and new practices and procedures for your patients and clients as well. And importantly, instituting a communications management point of contact and process at the board level, at the management level, and at the operational level. Why is this important? This is going to be a time of significant change and anxiety for all involved, and it is highly likely that you will have a significant uptick in the questions that will be asked of the organization, potentially engagement with media or other organizations as you commence the resumption of service. You want to ensure clear and consistent communications that are standardized across the all levels of the organization and that are delivered in a transparent and timely manner. And so it's important that you have these key points of contact and processes in place. Last but not least, risk oversight of liability risk. There is an unfortunate reality of COVID-19 related litigation and the potential for that type of litigation. We've seen it before. We've certainly not been through a pandemic of this nature before, but in previous epidemics, for example, in SARS, one can point to that to see what was some of the litigation that arose as we came through that difficult time. Claims could arise for the organization from employees, contractors, unions, patients and clients, third-party vendors. And so it's critically important that your health service resumption planning includes measures to minimize and mitigate liability risk. Board action items. What should the board undertake for risk oversight of liability risk? Well, number one, you want to engage in continued risk oversight of the legal, financial, and communication points that we talked about earlier. It's not a point-in-time exercise, is really my message to you. You need to continue as a board to have your eye on each of these items during this critical time of change and transition. You want to also ensure that there is a complaints and incident response protocol in place in the event that something goes wrong. Is there an issue with the administration of the PPE? Is there a complaint or action that is brought against the organization? And in that respect, as the organization identifies risk and potential risk and reporting, you want to have very clear expectations as to your board table and the level of reporting that you expect in this regard. Evaluate contingency plans. This is something where you should really take as a director a critical eye at the table as to what contingency planning is being put in place in the event that things don't unfold in the way that you have planned for them to do so, and how will the organization react. You are the directing mind of the organization. It's critically important that you actively engage on that type of contingency planning and have a solid understanding of how the organization will be able to effectively respond. And last but not least, insurance policy and coverage is one of the key risk transfer tools that every organization embraces. And as a board, you want to be reviewing what are your current insurance policies and coverages, engaging directly with your insurers to receive commentary from them on the ability of your existing policies and coverages to support your resumption planning. So we've covered a lot of material together today, from looking at all of the requirements that have been introduced around service resumption, to looking at what are the key pillars of a resumption plan and the key factors for risk oversight to be engaged by each of you as a director on your boards. And so I want to take the last minute that we have together today to take us all on a bit of a look forward on where we go from here, because your duties as a board are not only to engage in fiduciary risk oversight and immediate strategic planning in the shorter term, but also longer term generative thinking and direction of the organization. Times like these have different phases to how we proceed through the transition. There's the immediate emergency response, Then there's the recovery phase, which is where we are now. And ultimately, that leads into reflection. Part of that reflection is the forward-looking exercise of evaluating your crisis response. How did you respond? What are your areas of improvement? And updating your pandemic plan. This is a critical juncture at which to do that, because as we know, there is the potential for the second wave of COVID-19, and you want to ensure that you are ready to be able to effectively respond. And so you have an opportunity now to revisit what you did and revisit your pandemic plan and make appropriate updates. Assessing your leadership effectiveness and skills, gaps, and needs during this critical time. Did you have the skill set that you needed to respond? Do you continue to have the skill set that you need for health service resumption? And how might you supplement that by engaging in recruitment or engaging in appropriate advisors to support the organization? Reevaluating and setting the strategic direction for long-term sustainability. The plans that you had yesterday are not the plans for tomorrow. It's important to now take a relook and reset the organization of how it's going to proceed from a longer-term sustainability perspective. And to that extent, bringing us back to continued development of systems coordination and collaboration across the continuum of care, because it is that system transformation dialogue that will be essential to bringing us all through this recovery phase and beyond into the future. COVID-19 continues to have a significant impact on the delivery of all health services. We've talked about several rules, restrictions, guidelines, legal obligations to inform health service resumption planning today. We've emphasized also the importance of the board engaging in active fulfillment of its duties and its own interests of each of you individually as directors in ensuring you engage in continued and active risk oversight for the organization. And we've emphasized that this resumption exercise, and as we look forward, is not simply a return to the past, but it's going to be an opportunity for you all to look forward and continue dialogue on system solutions and transformation. We thank you all for joining us today. Please do direct any questions that you have. Feel free to reach out. Everyone stay well. Thank you.